Hello everyone. We are going to talk about Parkinson's disease today. We'll talk about the possible causes, the symptoms, and the goals of therapy for Parkinson's disease, or PD for short. So, how do we define Parkinson's disease? Well, Parkinson's disease is defined as the deficiency of dopamine in the substantia nigra, which is part of their brain responsible for motor movement. And that due to the death of dopaminergic neurons caused by the accumulation of a protein called alpha-synuclein that forms Lewy bodies when they're stuck together. The dopaminergic neurons are responsible for the release of dopamine into the substantia nigra, and a mutation in the alpha-synuclein protein leads to the accumulation of Lewy bodies. And over time, these Lewy bodies will spread to the cell and cause cell death, not just in one neuron, but it will also affect the surrounding neurons as well, which is why we call Parkinson's disease a progressive neurodegenerative disorder. So, what are some possible causes of Parkinson's disease? The reason why I said the possible causes is because we are not too certain about the actual cause of Parkinson's disease, but we think that it is caused by genetics, trauma to the head, and environmental factors. Factors such as heavy metals, factors such this includes toxins such as heavy metals and carbon monoxide, and many others. So some of the early symptoms is included bell rolling tremors, which is when the patient is shaking their hands. Almost looks like they're rolling a bell within their fingertips, which is where the name comes from. Next, we have cogwheel rigidity, which is when you have very rigid or stiff limbs, such as when your arms or legs are it's very hard to move them. And this is because of the action of the dopamine is inhibited. There's less dopamine, and which is makes it hard for the patient to move their limbs. Next, we have bradykinesia, which is slow movement, masked faces, which in other words, there's no blinking, and their faces are very expressionless. Then there's low voice, and this shuffling gait, which is when they are dragging their feet or they are very hunched over when walking. So as you can see, most of these symptoms are a result of the dopamine not acting on the muscles. Next, we have some late symptoms, which is forcing into positions, postural imbalances, which can be a cause for concern as it increases fall risk, difficulty swallowing and talking. Um, so because of the difficulty of swallowing, we need to be careful about what we give to the patients. So we need to consider if any drugs, if we can crush them or not. Also cognitive deficits. Some autonomic symptoms include orthostatic hypotension, which is when your blood pressure falls as a result of you standing. There's constipation, difficulty urinating or urinary incompetence, sweating, and seborrhea, which is when your skin produces too much sebum, resulting in an oily or greasy appearance of your skin. Next, we will talk about the goals of therapy. So some of the short-term goals is that we want to manage any symptoms and increase the quality of life. So I mean all of these symptoms. Of course, we won't be able to manage all of them, but we can target which ones are important to the patient and specifically come up with a therapy that is unique to every patient. Next, we have, so next we will talk about the long-term goals of therapy, which is we want to maintain the efficacy of the medications and tackle any new problems that may arise. What this means is that over time, the medications, most of the medications, no, I mean all of the medications for Parkinson's disease will lose their efficacy because there's no cure for Parkinson's disease. It's just some symptom management. But even still, these medications will lose their efficacy over time. And we want to manage that by maybe adding a new agent or switching over to something else. And what we mean by tackling any new problems that may arise is like these things, any side effects or adverse events that may occur from the medication or any new symptoms or signs that occur as a result of the Parkinson's disease. All right, guys, that's the end of the video. So this is meant to be just a brief introduction to the Parkinson's disease. On my next video, I'll talk more in depth about the medications used for Parkinson's disease. So until then, please like the video if you liked it, and please consider subscribing. I'm still pretty new to this, so I hope you like the content and stick with it. Thank you.